affected by leprosy. Thank you, madam. So, dear friends, ladies and gentlemen, so it's rather a challenging thing to talk on legal framework and its influence on persons affected by leprosy, but I will try my very best to give you the update. So, legal framework, why we need the law? So, it's for basically to maintain the order, protect individual rights and freedom, and ensure justice and fairness within the society. That is why we need a legal framework. So, according to this, is the Theodore Roosevelt. He is the 26th president of USA, called Teddy also. So, according to him, no man is above the law and no man is below it. So, does the prevailing law framework protect and ensure the fairness and justice for both the individual affected with leprosy and not affected? That is the question. So, as Dr. Supun also mentioned in the United Nations Principles and Guidelines in 2010, the UN General Assembly approved the principles and guidelines for the elimination of discrimination against persons affected by leprosy and their family members. So this resolution was a key step in legally establishing that people with leprosy have the right to be treated with dignity and should not be discriminated against. So, being a curable disease, now we know from early 1980s, we are having proven drugs with us, and discriminatory laws regarding leprosy persist in many countries, violating the rights of affected individuals. Most were formulated during the era where there was no treatment for this disease. So, just look at the global scenario, the global situation. Most of the laws have historic roots in 19th century. Practice of forced segregation as a way of control the disease and it protected the individual affected with leprosy. And as of early 2023, I have quoted these things from the International Federation of Anti-Leprosy Association. They are having a very good website. As for early 2023, according to ILET, identified 130 such laws in 23 countries. These laws have created legal challenges by restricting marriage rights, employment, access to public transport, violating voting rights, movements and residence. So, employment laws in some countries can prevent persons who have had leprosy from obtaining work permits or from working in specific professions. So, this is one example. There are plenty. And marriage and divorce. So, in some countries, including India, Pakistan, and Nepal, laws have historically been used to grant divorce based on leprosy diagnosis. So, in some of the parts of the country, so this thing is happening at the moment also. So, immigration and citizenship. There are certain countries they still have these laws restricting people from going in to their country. And segregation and exclusion. Discrimination laws can empower officials to banish people with leprosy diagnosed from public spaces such as markets, schools, and public transport, regardless of whether they are infectious or receive treatment. So there are these as examples I have down to. So voting rights. So in certain countries, still they were not having voting rights if they were diagnosed as having leprosy. So taking into account those global scenarios, so in Sri Lanka, let's look at what is happening in Sri Lanka. For these things, I have selected 3 laws and audience. Number 4 of 1901 Lepers Ordinance. Number 3 of 1897 Quarantine and Prevention of Disease Ordinance. And the last one, Establishment Code of Sri Lanka for Government Service. So this one, the Lepers Ordinance, as it says, ordinance for the segregation and treatment of patients. So when we read or go through this ordinance, we have to think about the era where first they have imposed this thing, because as we all know, in 1901, so the early part of 19th century, there was no proven drug. So they have, this ordinance is for the segregation and treatment of the patient. So we can see this law in different angles. So I will give you few of the things. So in this law, this ordinance is effective, talks about effective isolation and medical treatment. So in there, by this ordinance, they are ensured during that period, the leprosy patients, they were given the opportunity to be isolated. They were sent, they were provided with an institution to be there and take their treatment, and treatments were given during that era. So, via this ordinance, they have strengthened or they have thought about the affected people during that time. The other one, provision for patient houses of their own. So in this ordinance, it was allowed any person detained as a leprosy patient in a leprosy hospital may, by the special permission of the minister, could erect a house or dwelling for himself. Via this ordinance, they have provided this facility to the patients who will be there in the leprosy hospital. So in there, this ordinance also speak about administration of property of the patients also. They have thought about these things also. In there, they are mentioning what to do when the patient is there in the leprosy hospital, what is going to happen to his property, maybe in his house, maybe he will be having jewelry, any other belongings, what to do. So with this ordinance, they were empowered, they were helped what to do with their things. And sale on property of the patient. If the patient thinks that he needs to sell his property, via this ordinance, that facility also has been provided for the people who were there during that era. And of course, power to order the patient to remove to an detaining hospital, the leprosy hospital. So when we think about this ordinance, we have to think about the era where they were. So during that time, there was no treatment. Therefore, what they have done to minimize the spread of the illness, these people, the leprosy patients, has to be kept in somewhere. That is what we have practiced during the era of early part of COVID-19 also, because there was no treatment. We have to safeguard the other community, and the effective treatment, even as they had no effective treatment, those things were provided, and they have looked after the patients also, because they have, via this ordinance, they have given a place to the patients, they were kept there, and they were provided with medication. So via this ordinance, those things were ensured. And not to leave the premises without permission, so we can see these things in different angles. So maybe, as I told you before, we have to think about this individual patient plus the society. So they were not being allowed to go without the permission of the hospital authority. And as given the power of a magistrate, you might wonder why. So if you go through the history, they will say it's like it's a small village. So nobody was there. All the people were there, were affected with leprosy. They had schools, they had a police, and they have built of their own temples, church. It's like a closed village. So because of this thing, via this ordinance, they have given the power of a magistrate to the Director of Health Service. So now the current scenario, what has happened? As I told you, I have described what is the ordinance and what are the provisions they have given during that time via the ordinance. Now we are in an era where effective treatment is there. We are no longer segregating people. Because of that thing, this Lepers Ordinance 1901, the Cabinet approval has given in 2018, and this thing is at the Legal Draftsman Department. So we all know that because of COVID and everything has stuck in our country, but the Cabinet decision has been given to amend this law. So the other one is number 3 of 1897, Quarantine and Prevention Disease Ordinance. So we are listing also the same thing, equality, and we have to look after the rest of the community. At the same time, we need to provide the service of the affected people. It's not only for leprosy, for all the communicable diseases. So this thing is there in Sri Lanka. And the last one, establishment of the Government of Democratic Socialist Republic of Sri Lanka in the volume 1 in chapter 23. So in there also the less patients, if they want, if they can come back and work, the provision is there. They could be given 22 months of leave. That thing has to be decided by a medical board. So then what is the applicability of these laws to our current system? So in this Establishment Code also, it clearly says if the patient is in need, they could give leave. So now this is the most important law in Sri Lanka which will be applicable for the patients affected with leprosy. So now we have to think and interpret these laws, thinking about the era where they have imposed, and we have to work on to shape up or amend these laws to suit the current situation in the country and the globe. Thank you very much.
Thank you very much. Thank you very much to all the speakers. I believe you have provided a comprehensive description of the many challenges that are still faced by persons affected by leprosy in the country, both in law and in practice. And now I would like to open the floor for questions and comments from the audience, please.
In the absence of any question, are there any questions? Yes, please go ahead.
Good evening, madam. Thank you very much for your really informative lecture about this legal framework. So I have a question. As an example, this 22-month leave, so what are the cut-off marks? That is, the patient with disability or for all patients? So how it depends?
So now that establishment code is clearly said, if the patient is having deformities or disabilities, if we could return into work within some time with a recommendation of a medical board, they could be given 22 weeks. In there, they does not tell each and every leprosy patient could be given 22 months of leave. So we have to keep it in mind. It's for the people who are having deformities. If they are unable to work of their own, they were given the provision via this establishment code. Therefore, all the patients who will be diagnosed as having leprosy, they will in this via this establishment code. It was not warranted. Only for those patients who are having deformity, and for that thing also, they have to make sure that the patient in certain time, you would say after 22 months, he should be able to come back to his normal work. So that thing also has to be certified by a medical board. So it won't applicable for all the leprosy patients who will be diagnosed. It's a kind of a provision for the patient. It's not only for leprosy but also the other diseases also.
Thank you, Madam. Thank you.
Thank you, Didi. Any other questions?
Regarding the disability certification in Sri Lanka, usually grade 2 disability certification, they ask, especially the social service department, they ask if you want to get any assistance from government, if they want to go to the social service department, the social service department requests you go to the hospital and get the certificate of the grade 2 disability. Sometimes the people affected by leprosy facing the challenge, the grade 2 disability, sometimes they ask visible disability only, they get grade 2 deformity certificate. But sometimes the people affected by leprosy, they got the grade 2 deformity, but we can't see the visible disability. I don't know whether the health department still they are confused about this thing. The social service department, I think they don't know about that. But sometimes the health department, health department means the dermatology clinics, sometimes they didn't give the certificate to the patient, grade 2 deformity certificate, because they want to visible disability only they can give. I think according to my knowledge, the person affected by leprosy sometimes with grade 2 deformity, but they have no visible disability. I think any answer for that?
Dr. Now in leprosy, we will be diagnosing and classifying patients as having grade 1 deformities and grade 2 deformities. In grade 1 deformities, all those people who will be having sometimes numbness like things, if they cannot be seen visibly, we will be classifying them as having grade 1 deformities. So for grade 2 deformities, if the patient is having visible form of deformities, maybe clogging of the hand, foot drop, those kind of things will be classified as having grade 2 deformity. So if the consultant is sure that the patient is in need, for example, we say now the patient is having some numbness and he can't work off his own, and in such situations, as a special thing, I think it could be requested. So not only now that the patient is having grade 2 deformity, that means that patient is having any form of visible deformity. Visible deformity has to be there to categorize them as having grade 2 deformity.
Any other comments or questions? Thank you. So, if I may, and since there are, at least for the moment, no other questions or comments, can I make one question? So I think, and I am very sorry that I'm not able to translate to Mr. Amaratingue, but this is for the four of the distinguished speakers who made great presentations today. And it is about discrimination in law. Dr. Bellini was very clear. She provided a very clear and detailed mapping of the legal framework in place in the country. And Dr. Bellini was saying these discriminatory laws, they are from another era, right? But the fact is that whether directly or indirectly, they have an impact in current times. And the research, the excellent research presented by Dr. Yasoma today showed that there is still a high percentage of discrimination within healthcare settings. So in some ways, it would seem that the law is being implemented, even if in an indirect manner. So my question is, what should be done to abolish or amend this law quickly and create a new mechanism that can create awareness among the health services and promote inclusion? In your opinion, what could be done and how can that be made as quickly as possible, together with a very important target of 2035 to eliminate leprosy? Thank you.
So for me, indirectly it could be, but basically at the moment, even though that thing is there, it basically says if you do have leprosy, you need to be isolated. So the reason or the fact, what I see in our community is not that. One thing, from my perspective, I'm saying, so one thing that, during the era of there was no proven drug, people with leprosy, they will end up with different form of deformity and disfigurement. Those kind of things still they are in our community when they heard about leprosy. Those myths and fears, those kind of things are working on. That is why more often if someone is diagnosed as having leprosy in a working environment, they do have some kind of a fear for this disease. It's not to do something with this law for me, because the law says if you do have leprosy, you need to be isolated. At the moment we are not, practicing that law, even though that thing is there. I quite think we need to, amend those laws, and it has been started and will be followed up by the legal draftsman. From our perspective, we have given the concurrence and certain parts. Now we need to, remove from the law. As per the Ministry of Health, we have done our part, and from there onwards, the legal draftsman department, they have to take care. But personally, I think what we are having in our country is just here, the associated myth. It works on each and every patient. So that is why we are in need of a very good effective social marketing campaign. We need to tell you don't have to worry about this illness. Effective treatment is there. You are not going to have these kind of, disfigured features if you're going to put on the NDT. In my personal perspective, that is it, but I'm agreeing with you. We need to amend these laws because we are no longer utilizing them. Thank you, Devini. So I think if there are no other questions, I would like to summarize what we have discussed during this session. So our theme was people-centered approaches for elimination of leprosy. As we all know, it's beyond the medication, beyond the treatment. If we really want to eliminate leprosy, we have to think of other aspects such as the socio-economic impact, then of course the stigma, discrimination and gender, and of course the amendments to the legal framework. If we address those issues, we can really look forward to a patient-centered care for leprosy patients, which will help us to eliminate leprosy as planned. So I also would like to make a comment on behalf of the Ministry of Health. From the Directorate of Policy, we are revising the National Health Policy for the next 10 years, 26 to 2035, where we have identified the target of having zero leprosy as one of the targets in our National Health Policy itself. And also in policy statements, we have clearly identified the legal reform needed, including the leprosy ordinance. And also now we notice when Mr. Amarasinghe presented the voice of the patient towards stigma and discrimination. So in the upcoming National Health Policy, we plan to include the citizen voice and patient rights, the patient charter as major components. I am sure those aspects will help the elimination target of the leprosy campaign. With that, I would like to conclude this session with my co-chair, and thank you very much to all the expert panelists, the 4 panelists, and also to our audience for their comments and suggestions. Thank you very much.
Thank you very much to a brilliantly managed session and lots of value addition to the subject at hand today, to our chair and our co-chair. I'd like to invite them to make some presentations to speakers, to the panelists who were with us today. Dr. Supun Vijay Singha, Consultant Community Physician. Mr. K.G.M. Amarasinghe, President of the Leprosy People Association. To Dr. Nalini Vijaysekhar, Dr. Yasoma Veerasekara, Professor Nandri, are you here? Could we have you on stage to make the presentations to our chair and co-chair, please? To our chair, Dr. Vidya Kumarapalli, and our co-chair, Professor Alex Cruz. Thank you, Mr. Nandri. Ladies and gentlemen, that concludes the sessions for day 1, but it's only the sessions that we conclude. At 6 o'clock, downstairs in the Oak Room, we will be having a reception for you. We would like you to come in at 6 o'clock. It's just 1 hour. Basically, go and freshen up and just walk down to the Oak Room, and we have some very interesting events lined up for you this evening. So we will see you at 6 o'clock in the Oak Room. Thank you.